Alright, good morning. I'm going to do an incentive spirometry. So that's going to be just to help the patient open up their lungs, help them cough up anything, keep their lungs open after operation, so that way they don't get atelectasis, if anything like that. So first off, I'm going to check the patient's charts because I need to check to see what the doctor has ordered, and then I also need to see if they're going to have an operation done. I can always then I can go and talk with the patient beforehand, before everything, that way they are aware what we're going to do after post-op. So once I'm ready, I'm going to knock on the door, introduce myself. Hi, my name is Amy, and I'm a respiratory care student with the respiratory care department. And then I'm going to check their ID band, and then I'm going to make sure my hands are clean. So I'm going to wash my hands, dry them, and then I'm going to auscultate the lungs, and then I'm going to check their vital signs, their SpO2, see where they are at. All right, and then I'm going to position the patient to where I need to have them. So with this machine here, I need to have them sitting up just so where they can get the good lung expansion, so that way I can see where they are at. So I can raise the bed up, and then if they're post-op, I can have a pillow or something in front of them. That way they're more comfortable, especially if they're in pain after operation. All right, so here I have a volumetric exerciser. And so this is just to help them get a strong, inspired volume. That way they can open up their lungs, strengthen their lungs to help them cough up anything that they may need to do to help them breathe better. And with every volumetric exerciser, there is a chart. So there's a female and male, so you go based off of the age and the height. So I'm going to use me as an example. So between 20 and 25, so then it's 1900, 1850 here. And so then I will go in between there as a goal. But if they're post-op, I may start them out lower just to see where they're at, if they're able to, and then I can set goals to get up to the appropriate measurement that they need to be at. And with this, there can be something connected, like a little respirometer, just to connect to this. That way we can see where they are at ourselves, along with reading the milliliters, and see how good their inspiration is there. So first off, I'm going to instruct the patient to take a deep breath in and exhale, and on the exhale I'll have them inhale, and when they inhale I'll have them hold it 3 to 5 seconds, and at least until the piston goes back down to the bottom, and then I'll have them remove the mouthpiece and exhale normally. So I'm going to instruct them to inhale and then exhale, and then exhale normally. So I'm going to set this next to the patient's bedside if they need to do it at least 6 to 10 times per hour if they are able to, and if I feel that they aren't able to do that, we'll work their way up and set goals for them per hour to see where they can get them to. So when I am done, I can remove this. I can wash the mouthpiece and then make sure it's air dry if they are done with it. And then if they are not done, I can set it in a safety place, wrap a tissue around it, as they need to practice it every hour to get them their lungs working properly. And then at the bottom of every machine here, you can put their patient's name, the patient's room number, and then the date that I gave them the machine to help them. I can place it in there. And then when I am finished with that, after I have set it next to the bedside, that way it's easy reach for them, I'm going to wash my hands again, dry them, and then I'm going to reassess the patient, check, auscultate the lungs, see if they sound better after the treatment, that their lungs are opening up better, and then also taking down all the vital signs after post lung exercises. Then I'm going to go outside and chart on the patient's charts, and to let the doctor know that I have done a treatment, and to let them know where their lungs are at. That way if they need anything else, then we can give them something else.